Thank you so much for having us today. Really appreciate it. As Scott said, we are a behavioral health organization, Hegira Health, but what I wanted to point out about Hegira is we recently became a certified community behavioral health clinic, also known as a CCBHC. So that's going to be an acronym or term that you're going to hear as we proceed into the future, as Michigan has a lot of now CCBHC providers in the state, which is great. What a CCBHC does is it opens access for individuals who may be underinsured or uninsured, and that's excellent. We have a lot of individuals that come through our doors, for example, that can't get specialty services because of their insurance. They might have Blue Cross Blue Shield, for example, but can't receive a sort of community treatment, or their children can't be in a wraparound or home-based program. So this funding that we just received in 2020 really allows us the opportunity to get out into the community more and provide more services for people. So Hegira offers 30 programs and services to the community, substance use disorder and mental health, as well as youth prevention, primary care, and then we also operate community outreach for psychiatric emergencies, also known as COPE. So we hold the contract to provide adult crisis services in Wayne County. We also offer crisis residential programs too. So we have 6 locations, those 30 programs and services, and one of our more recent programs that we just developed and received grant funding for is called Pathways for Suicide Prevention. And that's our latest, newest program, really designed to meet people in the community, in the hospital, provide rapid treatment to individuals who are experiencing a suicidal crisis, had one, made an attempt. So we are providing the follow-up service right out of the hospital, which is the highest risk for suicide, 300 times greater risk actually for suicide is right out of an inpatient hospitalization. So we have been providing that service for 6 months, treated 63 people, which doesn't seem like a lot, but in times of COVID and not being able to get the referrals that we really needed, we're doing everything in our power to get out there and get those referrals in the door. So I'm gonna go ahead and share my screen. So I just want to go over just some facts and figures for you all. What we've heard over the course of the last year is that suicides were on the increase, that they were on the rise. And so just to put everything in perspective, suicide is the 10th leading cause of death, and homicide ranks 16th, but we do hear about homicide more frequently than we hear about suicide deaths, and it is the 2nd leading cause of death for youth. But there has been a decrease in suicides. So while we've heard, and we heard very early on, right away in March, that suicides were going to increase as a result of COVID-19, they really haven't. In fact, they've decreased in 2020. Suicide claimed 47,000 lives about in 2019, and then that dropped to just over 44,000 in 2020. So that is, we're cautiously optimistic in the suicide prevention, postvention world. That really speaks volumes to the amount of work that is going on now with suicide prevention and postvention. And when we talk about suicide, we oftentimes talk about prevention a lot, but we don't really talk much about postvention. So I will share some information about that. And just to put things into perspective too, you know, sometimes we hear this stuff, that doesn't mean there aren't crises going on. So while there has been a decrease in suicides, there has been an increase in the reach out for crisis services. So we have seen an increase in that in 2020. So approximately every 11.1 minutes, someone dies by suicide. That's 1.1 approximately attempts annually, although I will say that there are probably a lot more attempts than that. Those are really underreported. Oftentimes there may be an attempt where somebody wakes up in their home, never goes to the hospital, never reaches out to behavioral health treatment or medical treatment, or they're aborted attempts. Somebody may stop them, but as Scott mentioned earlier, due to stigma and other reasons, people don't seek treatment. But there has been a 5.6 decrease in the last 3 years, and that's really great news to hear. So I am, as mentioned earlier, I am a survivor of suicide loss. I've lost 2 family members to suicide. I lost my grandfather and my uncle. My grandfather died just a couple of months before I was born, and my uncle, who was 16 at the time, was witness to that death. And that really followed him throughout his years. And it really changed the trajectory of our family as well. So for every one loss, when we think about that, there are about 115 people, probably more like closer to 130 people impacted by that loss. And at least 6 of those individuals that are impacted by that loss really have devastating effects. And that was the case with my uncle. And back then, and I don't want to date myself, but I guess I will, in 1973, there wasn't suicide prevention programming. There certainly wasn't zero suicide. And there wasn't really a lot of trauma-informed treatment programming going on. And my uncle turned to drugs and alcohol. So that was how he was able to proceed with his own life during that time. It wasn't until I was 16 years old that I realized or was told or informed that my grandfather had died by way of suicide. And that was after my uncle made his first attempt. So at that point, he was using alcohol regularly, not sure about his drug use, but it was devastating. He did end up going into treatment about 3 years after that first attempt, and he was sober for 19 years. That's when he relapsed, he slipped, and did not think that he could come out of it. And he and I had multiple conversations. This was in 2008, trying to get him into treatment and then getting him the help that he needed. He was hospitalized. And I think one of the things that we tend to do is when someone's hospitalized for suicidality or a mental health condition, we kind of think, oh, well, they'll be better after that inpatient stay. And that's what I think back then we all thought. So when he came out of the hospital, we felt like he was in a good place. That was a good place to be. And that's when he died. So that's why I talk about post-vention services being so impactful and so important, and making sure that when we are talking about suicide with an individual or their suicidality, that we're making sure that we're finding them treatment for that as well. And that's something that I think in the substance use disorder world, we haven't really done a great job of across the board. In fact, we are a zero suicide organization. So what our focus has been on over the last 3 years is training and development of suicide pre and postvention services for our staff. We've trained all of our staff in evidence-based practices to support that, as well as develop policy and procedure. But one of the areas of focus is substance use disorder and the impact that has with suicidality. I just reached out to a zero suicide consultant that we use, and she said the same thing. This is across the nation. People have not been really focusing on suicide and substance use disorder, and that really does need to change. So as we talk about suicide and suicide deaths, these are the methods of 2018. These really haven't changed much. Firearms continues to be the most frequent use, as followed by suffocation and then poisoning for suicides. And then we, really want to focus on what the risk factors are. And as I said, obviously, substance use disorder, history of substance abuse, those are major risk factors for suicide. And really, we'll talk a little bit about opioid use and suicide deaths. But these are just some of the risk factors. The long and the short of this is that suicide is very complex, and there usually is not one reason why people die by way of suicide or why they attempt to take their life. It usually is a multitude of issues and problems, and when you use alcohol or drugs, it exacerbates those things. And so it really can be more of a major risk. When we take a look at other risks, physical disability or illness, we have seen actually, when you take a look at suicide deaths across the board, Black teens, boys and girls, have started an increase in suicide, as well as older adults over the age of 85. And so a risk factor for older adults, we're seeing more completions in nursing homes and in assisted living facilities, more than we ever have before. And that could be due to physical disabilities or illnesses, loss of independence. But really, even with all these risk factors, there is a theme, or some theories that have a theme of burdensomeness, isolation, and not feeling belonged to a group. So when you have all these risk factors and you have those other kind of areas of concern, the burdensomeness and the isolation, that can certainly increase that suicide risk as well. Losing a family member or friend to suicide, and that really is where postvention comes in. After there's a loss of life to suicide, a lot of people don't know what to do. They don't know where to go to get help, to get that support that they need. I know that after my uncle died, I did not know where to go. And there was still, even as a licensed professional counselor, even as somebody who worked in behavioral health, I didn't want to share that information with anybody at that time. You know, and I look back on it and go, oh my gosh, you know, there was so much more to learn about that whole process. I had reached out for grief counseling, but that was all I received. I didn't go to treatment. I didn't seek out treatment for help or anything else. And I think I was only in like a grief support. It wasn't even a group. It was just me with Angela Hospice, who happened to do it. And I think it was just for a couple of weeks. But it took me a year to even really refocus. It was so devastating. A loss of suicide is so incredibly devastating. So, you know, when we have experienced a loss like that, it's like in my opinion, it's like no other death I've ever experienced. And so it took a lot of time to kind of even figure out how to go through that grief cycle. Still go through it today. Every now and again, even when I present, I sometimes get choked up thinking about it. It's just natural. I mean, I think that's just part of being human. You know, that we go through those kinds of things, and I support that. And when we present on suicide education, and I guess I should have said this too, that this can be very triggering to people. Talking about suicide can be triggering. It's important. You know, we have Scott and Chris on the line. You can of course message them if you feel the need that you want to talk to somebody. But it can be, you know, devastating. It can sometimes put you right back to where you were in the moment where you found out. So that's why postvention is so important, because it isn't a linear process of grief. It goes in waves, just like I'm sure like all different types of grief do. But anyway, so those are some, you know, some of the risk factors that we talk about when we talk about suicide and suicide pre and postvention.